Notice that my collimation is not excessive. Okay, I don't care about anything else. I'm just focused on the actual, toe. And I have the distal phalanx, proximal phalanx, the joint, and possibly some of the, first metatarsal. Okay, I mean, if I can achieve that, it's fine. On number 2, I don't know if we can do this, but here it becomes the element of what, conversing with the patient, telling her, ma'am, I want you to try to kind of push that toe out, whatever. And we have to kind of become a little bit more creative, depending on how much that patient can do. If they cannot do much, the usual tricks, tongue blade, the most, used and abused element or tool in X-ray, technology, the tape, I mean, whatever it takes, so logically speaking, I don't see any problem with you trying to kind of practice some of those tricks. I mean, here, I'm not going to sit and but actually I should have got a tongue blade to show you how, but you get the idea. I mean, so this one and this one are lateral-medial projection, okay? This one and this one and this one, we go back to the medial-lateral projection, okay? So this way for number 3, and this way for number 4, and this way for number 5. If you have an injury here, gentlemen and ladies, I mean, you get the picture. I mean, if they're not going to let you even touch them, okay? So we do what we can. We try to adjust that foot, and we use our technique, hence the element of 312 to try to penetrate through these, if there is an injury, it's going to be tough, but you're going to work with the patient. You have to have a clear shot, as much as possible. But you get the idea. You work with them, they work with you. This is a good way for the first one, definitely the other way out. She was able to also give me this, not bad. For remaining 3, we might have to really use the tape. I mean, if she can bear the pain, I mean, it's okay. If not, you do what you can, okay? But that's the idea. The element is, this is a lateral, okay, tongue blade or whatever it takes. This is a lateral, this is a lateral, and on and on, okay? That's the idea. So all of these will follow the same pattern, okay? I mean, an AP survey foot, and then oblique of this particular toe, and then the lateral of it, okay? Now, coming along pretty good. I guess she's doing pretty good. Now she's coming for a foot x-ray, all right? Same old story. Introduce yourself. How you doing, ma'am, today? What happened to you? She was walking her dog and she fell in a hole, okay? Twisted her foot, definitely, we're going to ask her what is the pain, definitely not the muscle, but she's going to describe the pain anywhere between, here, and definitely our job is to describe also, having to do a good history, describe where the pain, lateral aspect of the foot, anterior aspect of the foot, medial aspect of the foot, whatever, okay? With a bruise, without a bruise, with injury, with no injury, some very basic description. I mean, we're not talking about something extremely, it's not really a half a page thing, okay? Patient complaining of pain in this area, or this area, or this area. I mean, it doesn't matter. With whatever injury it is, I mean, bruise or injury to the first toe, whatever you're going to describe it. But I mean, anatomic description is important. That's why we learn this anatomy. If I want to say that the injury is, or the bruise, or the cut is right here, I will call it at the level of the first metatarsal phalangeal joint. If it's here, I will call it maybe, I don't know, the area of the head of the 5th metatarsal, or the area of the base of the 5th metatarsal. And you get the picture, okay? But I mean, those things are important. We have to, what's missing here is what again? The angulation. So we're going to angle 10 degrees, and I'm going to really again do same story, come to the third, roughly, and that's it. That's all I need. And it doesn't matter if I move the tube, move the patient, move the table. I mean, you know, it's the same story, okay? I'm too close for comfort. Well, let's stay on the safe side. Here we go. Nothing wrong with that, you know? Look at this. Awesome, okay? Good, nice AP foot all day long with a marker right here. And you're done, all right? The oblique comes along, all right? I mean, usually, if I want to use my film very wisely, I'll have me another, you know, long, you know, so the line will be right on the line, okay? And then I know from this line on, I am 100% clear, okay? I mean, no exposure whatsoever. Then I'm going to put the actual foot right here, you know, talk to the patient always, please ma'am, roll your foot for me a little bit, okay? And I'll try, you know, many times, if they don't look right, I'll adjust my cassette. It doesn't matter. I mean, if this way or this way, however that patient can feel more comfortable, you see. It doesn't matter if my cassette is cocked. I mean, you know, what matters is the longitudinal axis of the foot is 100% parallel to the cassette, to the IR, okay? And really, with all honesty, look what's going to happen now, how much strain I'm going to put on her leg if I force her to do it this way. She's uncomfortable, okay? While if I do it like this, she's really more comfortable, okay? So you work with your patient. I mean, that's all it takes. Ultimately, I'm taking this off, going back to my, well, I didn't drop my distance, I'm sorry, but you get the picture, you know? Here you go. I mean, it's the same process. Look at this. Here we go, okay? That's the beauty about having those new collimators, that I can twist them, and I have the same exact, you know, I mean, same exact actually alignment, you know, of the beam, okay? And without putting too much strain on her leg, okay? All it took is just, you know, wherever she's comfortable, and I place that cassette under her foot, and that's it, okay? I'm not saying this one is incorrect, but, you know, the patient is uncomfortable, no doubt, you know? And you, once you are a patient, you know, you try it between each other, and that's what you're going to be able to achieve. This is an oblique all day long, very simple, nothing really to it. We're going to take, and notice that my collimation was always to that line, right there. 1, 2, 3, 4. Okay? That's all it takes. You know, we're not going to collimate any less, and not going to make any more. Now, where's the 8x10 that I entrusted you with? Here it is. Okay, we're going to take that cassette, and we're going to ask her to put her, bend her knee, she needs to roll, but ultimately I need the metatarsals superimposed. That's my goal. How she can achieve it, it doesn't matter, but you know, it does matter, but I mean, you know, that's what I need right there, okay? And definitely, I'm gonna bring that beam, you know, and I'll twist whatever it takes, do, you know, what's needed, but that's ultimately what I need. Paying attention, I'm not gonna clip the toes. Paying attention, I'm not gonna, you know, I'm gonna show as much as possible of also the ankle joint, whatever, you know, like this. There we go. You know what I'm saying? Main and marker right here. That's it. I am done. Okay? Needless to say, you can see very well that I didn't do it that way. You know, she got a big foot. Okay? So if I have Marvin here, no way I'm gonna have to really use a 10x12. You get the picture? Okay, so it's all about common sense. Okay, nothing really fancy. Here, you know, I'm stubborn. I'm insisting on using an 8x10. She got a small foot anyway, you know, and that's it. Okay, but I have to really make sure I'm not clipping anything. You know, so you know, I mean, I can see the shadow of the whatever anatomical part and make the appropriate adjustment. Okay, here her toes. You know, they are on the film. You know, a little too close, but they are. I mean, you know, if I'm iffy, hey, nothing wrong with that. But I mean, look at what I'm showing. Everything. Okay. A marker right here, and that's my lateral foot all day long. Very simple, very simple. I mean, okay. All right. So, oh, I'm sorry. I forget to mention the toes. We with previous X-rays. Okay. Well, it's the same story as fingers with previous X-rays. I'm going to have this film split into 3 sections, and that's how I'm going to do it, 1, 2, and 3, which is, you know, now if I'm doing it by itself, you know, I can really place it, okay, go ahead, right here, I mean, again, the center of my attention will be toe of interest, okay? If I'm doing the first toes, then definitely the first toe will be kind of in the middle, you know, or the second toe will be in the middle, okay? Or the third toe will be in the middle, okay? That's the idea. And like I said, your collimation will help you determine, you know, I mean, that's it. We're not going to split here, okay? This will be what, in your opinion? I mean, I'm mainly in the second toe area. If I want to do the third toe, I will move her, okay? And I am in the third toe. I mean, you can tell the center of my attention is on the third toe. I mean, you want to collimate some more, you know, it doesn't matter. I mean, you know, as long as you show me the phalanx and the joint above it, that's all I need, okay? And definitely, you know, I'm going to move that leg. I'm going to flip this. If you look at it, plenty of space, you know, okay? I'm going to do it like this. Place again that foot and give it an obliquity, all right? And that's what you need right there. And I will put basically whatever toe I'm doing as my center of attention, okay? So I'm centered to this midline of this field, as you notice, and then all I have to do is just, you know, focus on the appropriate toe. Number 1, number 2, number 3, or number 4, or number 5, you know, that's the idea. Okay, nice and simple. Lateral is the same dilemma, you know, exposed, and exposed. See, you know, you put it right here, and you fight again with the toe of interest. You know, again, let's stick with the first one. That's the easy one, to be honest with you. You know, I'm pushing her here because that blocker is in my way. So, you know, again, I'm in control. I can see really what's available to me and I can work with. But ultimately, that's what I'm achieving right there, you know. Here we go. I mean, this is my lateral toe right here, okay? Maybe, look at this. Hold on. There you go. There you go. That's it. If it's a second toe, well, you know, I don't know if she can do this, but there it is. Look at this. That's pretty good. That's pretty good. With a tongue blade or a okay? I mean, but you get the idea. If I'm doing the others, then definitely we'll go to the mediolateral projection, and then we're gonna do something like this. There you go. If she can anyway, but you know, if she can't, so we're gonna have to put, you know, tape into action, okay? This way or this way, I'm not sure. This way, there you go. All right, you get the idea. All right, come on along. So toes, with and without, and with previous and without previous. Now we go to ankle. Now ankle is what